as dentists, we're constantly bombarded with bacteria and viruses that our patients are sometimes unaware that they have contracted, usually due to either the cavitron or the high-speed handpiece releasing out particles. So the Aerosol Assist has been excellent in absorbing all these particles for us. It's been something that we've implemented, and we always tried to be careful before, but I think what's happened within the past year with the pandemic, we've become much more aware of trying to limit the amount of aerosols that are going on in the office, trying to keep it isolated to that one operatory, and the Aerosol Assist has been fantastic for that. We mostly use the Aerosol Assist in our office for hygiene, but everybody's been in a situation where the assistant has to walk away for whatever reason, and you're not getting as much suction as you would like for whatever procedure you're using. That's when the Aerosol Assist has been a good option for me. It really helps minimize the amount of water that's in the patient's mouth, and it keeps things isolated and dry, amongst just, again, trying to keep water particles selected to that one area, that one operatory, so it's not an issue going forward for other patients. So when we first got the Aerosol Assist, I was actually surprised. I was wondering if it was going to be working for what it said that it was going to do, but I really enjoy it. It's so compact. Patients barely complain, if at ever. They prefer it over other suction apparatuses that we've used before, because it just it's very compact in the patient's mouth, and it's very easy to sterilize. So it's been effective in getting our patients in and out the door at our office. Sometimes some of these isolation apparatuses, they're limited by whether patient is fully edentulous, or they're able to masticate on one side. The Aerosol Assist, that's not a problem. It's just completely based on whether it can hang off the patient's cheek or not. And it did the job perfectly for a situation when I was doing a crown prep, but we couldn't use the isolation the apparatus that we usually use, and one of our assistants was away. So I was like, hey, let's try it out. Let's see if it works. And it was fantastic. The patient didn't complain. She didn't even realize when we were finished, because it was so quick. It was absorbing all the water while I was working and kept things dry, so I didn't need the assistant when I was working there. It was fantastic. The Aerosol Assist has been great for our hygiene in terms of, I've noticed the tick around how quickly they get through a procedure now, whether it's a scaling, a debridement, or just a regular prophy. It's getting done much quicker because she's not having to worry about suctioning. It's constantly suctioning for you. So in that case, we've actually been able to shorten our appointments because of how quick she's running with it now. And then in terms of reusability, towards when you compare it to other products, it's fantastic.